My name is Nathan Tanner. I'm a general dentist practicing in Medford, Oregon, and I have been on my airway journey since 2010. More dentists need to understand that airway compromise is happening really from birth. People's jaws are underdeveloped. Cancer and sleep apnea used to be a condition of the elderly. Today there's pediatric cancer centers, there's pediatric sleep centers, and children are getting put on the CPAP machine more and more often, just like we're seeing crowded teeth in children more and more often. And it's happening at younger ages than it used to be a generation or two ago. And this is something that's affecting their lifelong health. When people get sleep apnea, they first start to have restless sleep, don't sleep well, take the sleeping pills, but sleep apnea progresses and gets more severe throughout life. So it's something that the sooner and the younger we can help people develop a better airway, the better for their lifelong quality of life. In 2010, I had a young lady whose father did not want her premolars to be removed for her braces, which I was doing IV sedation, taking out premolars, taking out wisdom teeth all the time. I thought it was unusual that this father did not want his daughter's premolars taken out because that was the standard of care. But as I began to research and learn about airway health, I realized removing teeth is not the best thing for the long-term health of the patient and their airway. What I have discovered over the last over 10 plus years is that the younger we begin opening people's airways and helping them get better sleep and quality of sleep, it begins to have an improvement on their health almost immediately. What I've realized is a lot of people are suffering more than they are even realize or aware of. I've tested many people who said they sleep great, they're out like a rock, they sleep wonderful, and we put them on the echopharyngometer and we show them how there's really a compromise in the airflow. There's decreased airway space. And so they go home, they take the sleep test. Many of these people who thought they were great sleepers are actually moderate or severe sleep apnea. They've just gotten used to it. What I've learned is that our airway and our jaw development and our airway while we're sleeping is a big piece of the puzzle, not a little piece of the puzzle. There are many things people do to try to sleep better. Sleep hygiene aspects, there's medication aspects, there's herbs, there's different pillows, there's different strips or things people use to try to sleep better. What I've learned is the airway and positioning and supporting or developing the airway is a big piece of the puzzle, not a little piece of the puzzle to airway health. Dr. Jeff Harrison will be wonderful at guiding you on your journey. He's been very, very instrumental for me in progressing and moving and being able to serve and help patients. And he'd be happy to connect us together. If you'd like to connect with me, I'd be happy to talk with you more also.